Hi guys, Dr. Megan Brining here. I wanted to talk about how to determine your fertile window because this is a question I just recently got asked on my Instagram page. And it's a really great question because you want to determine your fertile window, whether you're just tracking your cycle for health, whether you're tracking your cycle to become pregnant, whether you're tracking your cycle to avoid pregnancy, or whether you're postpartum and you want to find what's called your return of fertility, or that first period that happens when you're postpartum at some point later from when you have given birth. So when we talk about the fertile window is for most women about 7 days. And the reason why you are fertile as a woman for really only 7 days in your whole menstrual cycle is because of two things. Number one, the egg, when you ovulate and release the egg is really only viable for about 12 to 24 hours. So if you want to get pregnant, ideally, there should be some sperm in your body waiting to fertilize that egg. And if you're someone that wants to avoid pregnancy, then you don't want sperm in your body waiting for that egg to drop. So there's a couple of things that you need to consider when you are determining your fertile window. One is knowing how long the egg is going to last, so 12 to 24 hours. And the other is that you have your own naturally occurring, what we call cervical mucus or cervical fluid. And this is the discharge that you see from your vaginal opening or on your underwear, generally in the middle part of your cycle. For some women that ovulate later, you might see that later on in your cycle. For some women that ovulate earlier, you might see that earlier in your cycle. But what you should see for the start of your fertile window is some change of fertile cervical mucus from what we call non-fertile cervical mucus to fertile cervical mucus. So what this looks like is you can have multiple different types of cervical mucus, but some are fertile and some are not. So the purpose of cervical mucus is so that when you're trying to get pregnant, the sperm literally have little channels, and they have little channels of cervical mucus to swim through. The cervical mucus helps to shuttle the sperm to where they need to go to fertilize an egg, and they help to protect the sperm, which is really important if you want to get pregnant. But if you don't want to get pregnant, then you have to be extra aware of when you start to see fertile cervical mucus, because it's essentially like a shuttle for the sperm to get where they need to go. So fertile cervical mucus generally looks either really wet or it looks really stretchy, and really it looks like an egg white. We call it egg white cervical mucus, and that's generally the highest type of peak fertility, peak cervical mucus. You can have creamy type of cervical mucus, you can have sticky, you can have lotiony looking cervical mucus, and there are when we're putting cervical mucus into a category of either peak or not peak, generally the drier types of cervical mucus that are less fluid are going to be considered non-peak, and then the cervical fluid that is more wet, more slippery, more egg whitey, that is going to really allow the sperm where they need to go. So because around ovulation, cervical mucus, especially fertile cervical mucus, is going to increase, that extends your fertile window because the cervical fluid allows sperm to stay alive and stay around. Now, the vagina is naturally very acidic, and semen tends to be more basic because, you know, when you're trying to make a baby and he ejaculates into the vagina is going to be acidic and it's going to kill some sperm, but we want the semen to kind of protect the sperm, the seminal fluid, which is more basic, so that the sperm have a higher chance of getting to where they need to go, and then put on top of that cervical fluid, and you got a nice recipe to get the sperm where they need to go. So I'm kind of talking in circles here, but I hope you guys kind of understand what I'm talking about. So the fertile window is the 7 days where you have the most fertile cervical mucus. And it's usually around 7 days because say you have sex and you have unprotected sex and you have some fertile cervical mucus around, but you're not ovulating right away, and maybe you're ovulating in 3 days, there is a chance that you're going to become pregnant because the fertile cervical mucus is going to help the sperm go up through your cervix into your uterus, and these sperm are going to hang out in your fallopian tubes and wait for an egg to be released. And that's great if you want to get pregnant. It's not great if you don't want to get pregnant. So when we're talking about the fertile window, the cervical fluid that you naturally make will create and extend the fertile window. And then the possibility of sperm living inside a woman's body is high when there's cervical fluid, but sperm tend to live in a woman's body for about 5 days. So if they make it through the cervix, up through the uterus and into the fallopian tubes and are just waiting, then whenever the egg pops out, that woman can possibly become pregnant. So when you are coming off of postpartum, it's really important to track a couple of things to catch when you are going to release an egg. And then about 2 weeks later, we would expect you to have some sort of bleed or a period. So what generally happens is most women, and if you're exclusively breastfeeding, it changes a little bit, but most women are going to notice a return of fertility around their 6th month. And again, if you're exclusively breastfeeding, then that does change the timeline. And of course, all of the other factors that have affected your baby, that have affected you, that have, there's so many different reasons why women get their period sooner or later. But you can look to see when your first ovulation happens after postpartum if you're tracking things like basal body temperature and cervical fluid, because what you'll notice is that when you're not fertile, your cervical fluid tends to be either sticky or dry. And then as you get more fertile, it becomes more wet, it becomes more egg whitey. So what a lot of women are going to notice is that after they have a baby, they're going to have their bleeding for however long their body bleeds after birth. And then things might be a little bit dry, or they might be a bit sticky in terms of cervical fluid output until the body is gearing up for releasing that first egg. And then you're going to have your first cycle. So you can watch your cervical fluid and you can track it every day and put that in the tracking app that you are using. Now, if you're someone that is using Tempdrop has a way to track this in their app. If you're someone that is using a different thermometer, or if you're using a different app, like I really like Read Your Body app because it's very fam friendly. You can put all that info in the app so that you can look at your chart and see when is your cervical mucus starting to shift. When your cervical mucus starts to shift from non-peak to peak, then that's a really good sign that your body is starting to gear up to ovulate. The other thing that you can do is you can take ovulation test strips or LH strips, and you can see how high your LH number is going. Now, LH is called luteinizing hormone, and LH is a hormone that your body is going to release, and it's going to spike, and that spike is going to cause the release of an egg. Now, just because somebody's LH numbers are high or you're having LH peaks does not guarantee that you're going to release an egg. It just means that your brain is sending that signal to your ovaries to get an egg to be released. But you can track LH surges, is what they're called, and there are apps to do that. The Premom app is really good for this because you can actually take photos of your what we call OPKs or LH test strips and see the peak, which is nice. But generally, once you get an LH peak, your body is going to ovulate 12 to 36 hours later. It's usually close to the 24 hours later. So once you get peak, your body's going to ovulate about 24 hours later, hopefully if all things go well. So if you're testing basal body temperatures, if you're testing cervical mucus, and if you're using LH test strips, then you'll be able to check or catch your return of fertility after you have a baby. But the same thing applies for all women when they are tracking, well, almost all women, when they are tracking their cycle in order to determine their fertile window. So you can do the same exact thing. Use LH test strips. I usually recommend starting to test your LH on day 7 of your menstrual cycle, so after your period is done. But some women ovulate early, so starting at day 7 is kind of a smart thing to do, because if you don't know when you ovulate, you might ovulate a little bit sooner. We might miss your peak. We might not catch a peak when we test it with the strips. So you can start testing your LH 7 days or 7 days, the 7 days of, oh my goodness, on day 7 of your menstrual cycle. And then most women, if they have a monthly menstrual cycle, most women are going to ovulate somewhere in the middle of their cycle. So medically, this is day 14, but not all women ovulate like clockwork on day 14. So that is why we start testing LH a little bit sooner, so we can see the peak. And then what happens after your body ovulates is you're going to see a increase in basal body temperature. So what you're going to notice is that your temps in the first part of your cycle are going to be lower, and then after ovulation, usually takes about 1 or 2 days for your progesterone levels to go up. But your progesterone levels will go up after ovulation, and that will cause a spike in your basal body temperatures, and then that temperature is going to be sustained until you either have a baby, like if that egg was fertilized, if you were trying to get pregnant, that progesterone level is going to stay up and your basal body temperatures are going to stay up. Or if you're just charting your cycle, then what's going to happen is you're going to ovulate, and then your basal body temperatures are going to go up, and then progesterone is going to keep them elevated until right before your cycle, right before when your period comes, when the temperatures are going to drop. So if we're combining LH test strips, if we're combining basal body temperatures, and if we're watching cervical mucus, then that is really the best way to determine the opening and the closing of your fertile window. For most women, it's 7 days, but where that 7 days occurs is going to be very different. So if you're sitting here and you're like, ooh, I don't know when my fertile window is, and you know, maybe you are postpartum and you are waiting for your cycle to return, you can track these signs and figure out when your period is going to come. You can figure out when you are going to ovulate again. So this type of method is called the Symptom thermal method. It's part of the fertility awareness method, and there's a variety of ways that you can interpret the data on your charts. So I was introduced to temperature charting for cycles back when I was like 13, 14. So I self-taught with a book called Taking Charge of Your Fertility. And this is a book that, it's by Tony Weschler, by the way. This is a book that for a long time has been called like the Fertility Bible. It has a lot of excellent information about like, what is cervical fluid and what is temperature tracking and what the heck are you talking about, Dr. Meg? Like, I have no idea what you're talking about. I've listened to you for 13 minutes now and this all sounds crazy. Well, the book will tell you a lot of information about it. It's very easy to read, and it's broken up into chapters depending on what phase of life you're in. So if you're trying to become pregnant, it has a whole section on that. If you're trying to avoid, it has a whole bunch of info on that. If you're trying to figure out like what the heck is happening with your cycle, it has info on that. So I self-taught using the Taking Charge of Your Fertility method. There's also methods like Sensi Plan, Boston, Billings, Marquette. There's lots of different ways to interpret temperatures, interpret cervical fluid, and the key is that you find one that works for you and you stick with it. And if you are really diligently looking at things like LH levels and your cervical fluid and your basal body temperatures, then you will definitely be able to figure out where your fertile window is pretty effortlessly. If you need help, I always recommend that people work with an instructor. So there's lots of great women out there that help women to learn how to chart. And you can also self-teach yourself with books like Taking Charge of Your Fertility. So I recommend that book to a lot of my patients. And one thing that I like about the book is that it talks about a lot of things that us women experience that we might not have learned from our moms, or we might not have learned in sex ed in school, or we just might not have learned really from anybody. I can't tell you how many times I talk to patients about the presence of cervical fluid, and they just thought their whole life that they were having infections down there, and really your vagina is a self-cleaning system. So you're going to have some discharge throughout your cycle, and then your cervix is going to create some fluid that comes out of the vagina that you see also. And so all of that is normal, and it doesn't indicate infection unless it's, you know, some sort of fishy smell or a green color, or it's different from your normal pattern. And I can't tell you how many times I've educated women on that, and they're like, wow, I thought something was wrong with me my whole cycle. So lots of really good info in that book. So I recommend it to a lot of people just as a good education source for some basic female hormone education. But yeah, so that's how you determine your fertile window. I hope that was helpful. It's a really important thing to determine no matter what stage of life you are as a woman, because if you want to avoid pregnancy, got to figure out when your fertile window is so that you don't have sex during that time and possibly fall pregnant. You also, if you're wanting to have a baby, you need to figure out when your fertile window is so that you can time intercourse so that you can make a baby. Really, really important. But thank you guys, and I will see you on the next video.